Yeah, it's a different population. I mean, we're seeing today, the majority of patients that I see are patients who have been started on opioid pain pills for, a legitimate injury, car accident, sports injury, whatever the case may be. And they're started on opioid narcotic pain pills, and then they were suddenly discontinued without realizing the dangers, and were unable to get the prescriptions after that. And then, of course, it becomes a desperate situation, and then they run into heroin. Somebody says it's cheaper, it's more available, just try this. You don't have to do doctor shopping, you don't have to worry about that. Let's try this. And so I'm seeing that. I would say the majority of patients that I diagnose today started that way. I think that we are reaching a high point in terms of awareness, and I think that that's an important step. I think that the government has become aware of the epidemic. So on a national level, we're taking a look at this and recognizing that this is a real problem. So I think that that's good, because then that starts to point funding toward treatment and so forth, and I think that's a really good first step. If you can get the word out there, then you can catch people's attention.
Epidemic.
They've been hit extremely hard, and I think that there are so many more complex issues involved in treating women. They have children, they have, families that they have to take care of. So getting a woman into treatment is a more complex issue. For instance, if you want to send them away to detox, who's going to keep the children? Rehab, who's going to keep the children? Some of them are afraid to come forward because of CPS issues and, getting child services involved. So there's a lot of fear, there's a lot of misinformation about what the consequences will be. You're putting people's lives back together, and it's really tremendous. It's a tremendously good feeling when you see that, and so that's what we need to see more of, And I think that it's important for people to understand, not only providers but also family members, the public at large. They have to understand that the outcomes for this disease are similar to the outcomes of treatment of other chronic diseases. I think that's very important, because people, I think, have a sense that you're wasting a lot of resources and time, and you're only going to save a few. But in reality, that's not true. These outcomes are similar to successful treatment of diabetics in terms of compliance and controlling the disease. So I think it's important for people to realize that this is not a futile effort.